We have an entire range of treatments that ranges from very conservative to very aggressive. And we need to match that to how much pain you have, what you've done before, and your personality. If you're a very aggressive person, then you're going to want very aggressive treatment. If you're a very conservative person, you're going to want a very conservative treatment, and we can match that to what you're looking for. So on the conservative side, we start with things like physical therapy or occupational therapy, trying to get you, to relearn exercises or to relearn how to do things. We have things like acupuncture or behavioral medicine treatment. A lot of times living with chronic pain is sort of learning how to deal with it or how to cope better with the chronic pain. We use medications. Most of the medications that we prescribe are not narcotics, but there are other medications like anti-inflammatories, more powerful than like an Advil or a Aleve. We use a lot of medications for chronic nerve pain. One of the most common things that we see is people with burning in their feet because they have diabetes. What they need is somebody to treat the nerve. So we have a variety of different nerve pain medications that we use for them. Sometimes we use supplements. Vitamin D is a really good example of something we use, or vitamin B12 is something that we can use to treat pain. Vitamin B6 orally can sometimes help nerve damage. We refer out for yoga. A lot of our patients really like doing yoga. Pilates is another thing that's become quite popular with a lot of our patients. For our fibromyalgia patients, Tai Chi has actually been shown to be very effective. Then after that, we can get to some of our more advanced treatments. Things like epidural steroid injections, which a lot of people have heard of. Epidural steroid injections are a very nice treatment to reduce that nerve pain that's going down the leg, and a lot of times help you avoid surgery. They're minimally invasive. They're actually done right here in our office. You walk in, it's a 15-minute procedure. You go home that night. It's very simple. Facet joint injections for people with arthritis are very common. So arthritis of the neck, arthritis of the lower back, that kind of pain when you wake up in the morning, it's real stiff and achy. Or radiofrequency treatment, which is a follow-up. And that treatment can last 6 months to sometimes 2 years for patients. And so they don't have to take medicines. We do joint injections, so shoulder injections are very common, knee injections are very common, hip injections for arthritis in multiple areas. And then for our patients that are really advanced in pain management, we do implantable stimulators. It's a high-tech device. It kind of looks like a pacemaker, and it's designed for people who have chronic intractable pain for which really nothing else works. We also have implantable pumps, where we can actually deliver medicine directly to your central nervous system. So rather than taking medicine by mouth, which has all kinds of problems, we can actually deliver it directly to your central nervous system. It's 300 times more powerful, which means we can give 1/300th the dose, which means a lot less side effects. And then the latest frontier that we're really looking at is regenerative medicine. And I'm really excited about regenerative medicine because this takes us from treating the pain, but not treating the problem, to really trying to treat the problem. Everybody's different. And so you may get yoga, an injection, and ibuprofen. And the next person might get acupuncture and a spinal cord stimulator. But the therapy is going to be targeted to who you are and what you need. Our goal here at Capital Pain Institute is to help you get your life back. There are a million different ways we can do that, and that's going to be different for each one of you. But what we want at the end of the day is for you to come back and say, Doc, I can do this again. I couldn't do it before, and now I can do it, and that makes me happy. And if you can do that, then we've done our job.